I first became part of ARMOM, I really did not know that this would continue every year to the 10 years that we're now celebrating.
I think it's a testament to the great organization and the wonderful volunteers we have here in Arkansas that we've been able to promote this and keep it sustained and grow it every year and take care of the needs that we've been able to take care of.
Well, I can't say enough about Ed Choate and Delta Dental. Without that seed money, it would not have happened.
Delta Dental offered to cover all of the costs for the first Mission of Mercy because we knew there would be a lot of things that were unknown, and that took some of the complexity out of getting something like this going. The ASDA committed all the clinical resources we knew they were going to provide, and so we began.
The first year when we walked out that door and I saw that line of people, it scared me to death. I thought, we don't know what we're doing. There's no way we can process this many people. And then we just started working and figured it out.
You know, we first started out in Little Rock and then we've been all over the state. Each time we've done a different venue, it's been a different challenge.
You know, for whatever reasons, I don't think we have ever set a clinic up the same way twice in places we've been back to, because we've learned a little bit to try to do it a little bit different. Each person in the entire group, I think in every section, you're always looking to do just that little bit more to make it better.
When I first worked volunteer registration, it was all on paper and it was inefficient and inaccurate and time delayed. But I noticed that we could easily make some efficiencies. The volunteers have definitely noticed how much more efficient the registration process is. They have a barcode, we scan it, they get to go about their business.
We were brought in on it to help out some doctors that we do business with. And then it grew into our team really looking forward to doing it every year. It kind of became a staple of our whole yearly planning. It became basically just conversation all year long within our branch. And our people really look forward to it. They like the idea of giving something back to the community.
The first thing that I believe ARMOM is great about is sharing the weekend together with my dental colleagues. There's nothing else that we do that we actually get to share dentistry together and learn from each other. And I'm telling you, as a surgical director, by learning these 10 years, we have greatly improved the treatment of the patients that do come to ARMOM.
The hygiene team is awesome. It's very, very hard work. Most of the patients have not had their teeth cleaned in years or ever, and they are providing a service that they would not be getting otherwise. The hardest thing for us is we would like to follow up, and we could see the patients over and over again, but just that one experience with them, we know we've helped them.
So being the interpreter captain, I've been able to connect the local community to the event, plugging folks that are bilingual, whether that is Spanish speaking or folks that speak American Sign Language, or people that speak Cantonese or Mandarin, German. We've had all sorts of languages spoken at this event. So to the provider, it's a safety thing, it's a quality of care thing, and they're able to communicate through the interpreter what that patient needs to know.
Me personally, being part of ARMOM for 10 years has been one of the most rewarding things I've ever done. But the volunteers, my team at Henry Schein, coming, 10, 15 strong every year for the whole weekend, that gives us a lot of good quality exposure in the community to show what the culture of our company is and that we do give back.
Over the last 10 years, Delta Dental has committed at least $100,000 in funding, either directly to the Arkansas Mission of Mercy Foundation or to purchase other services that are necessary during the event.
10 years later and $1 million later, we now have 18,000 patients and $9.5 million worth of free dentistry, and it all started out with Delta Dental Arkansas. So on behalf of the Mission of Mercy and all the underserved patients of the state of Arkansas, many thanks to Delta Dental for 10 years of service.
This is something that is so very important to us that I can't imagine us ever, frankly, not being a major contributor for this event for many, many years to come, because it's central to who we are, our mission to improve the oral health of Arkansans, and it gives us an opportunity to participate so closely with the dental community in something that's near and dear to their hearts as well.
When I became involved, although others had done so much to make this happen, we had to start looking at this in long-term business-wise. In any corporation, in any organization, you have to have somebody that says, okay, we're going to develop this game plan, we're going to develop this business plan into long-term. So we have had a large number of different organizations who have come forth and helped us, of which, without a doubt, is Walmart. Their foundation has been just an immense help to us.
The Walmart Foundation looks at the needs of communities and also in our states, as we have a state giving program. And we understand, the foundation understands that in Arkansas, dental needs are a challenge for the underserved individual. And what we can do to help that program, we do our best.
We really feel like that we've made a difference in people's lives, and that is extremely rewarding, and it's something that we're blessed to be able to do.
I think I'm most proud that we're able to take care of a large unmet need and a group of people that really need our help.
These guys, they're heroes. You want to talk about people that go in the service, that are defending our country, they're heroes. These guys are heroes.
I'm just really grateful to have the opportunity to be helped today. And I've been in good hands the entire day, and I'm just really lucky. So he's amazing. I really appreciate it. Thank you so much.
You're welcome. The doctor just got through telling me he's going to be able to pull all the teeth that are giving me problems out. So my next thing is probably next month I can go down and get my partial and have a full set of teeth again. And I haven't had it in 15 years.
Going to ARMOM in Arkadelphia changed my life. By the time it was all over, it restored my smile, my sense of identity, and it made me a new person altogether.
Everyone's here because it's this simple. I care about you. I want to help you out. What can I do to help you out?
I think it's a wonderful idea what they're doing, and what these dentists are beautiful people that they're offering up their services at no charge to all these people. Yeah, I mean, a lot of people, we can't afford our own dental insurance or stuff like that, and we still need our teeth taken care of, for our general health. Things like this give people hope that, somebody cares about them, that somebody's looking out for them, so that they don't feel like they're getting lost in the Medicaid system or the medical system.
I've gone so long without dental care that I have to have 4 or 5 teeth pulled. I'm going to lose today. Very serious, It's so important. If I could have done this 2-3 years ago, I would have been able to keep them teeth. But I'm thankful. I'm thankful.
I told the patient it is a blessing for us that he was brought to us to take care of him. And I really meant it from the bottom of my heart. And I also told them, sometimes you work and not get paid for it, and you enjoy it 1,000 times more than when you work and get paid for it. And this is the day that we had that.
It's just a great message that us dentists really do love the idea of taking care of our community.
I honestly feel like I get a lot more out of it than they do. Yes, they get out of pain, but I feel so good helping people, which is why I got into dentistry in the first place.
Yesterday was a challenge. We ran late, but people in my area instructions, we stayed. We stayed until we finished the last one. That's our job.
We expect that if people take the time to try to come for treatment, we have an obligation to take care of them and to provide their treatment. And so it's been our goal every year to not turn anyone away.
Anytime you work on a child, it is life-changing, it's rewarding. You have so many children that begin crying, end up smiling and laughing. When a child is hurting and they're not anymore, it's the greatest thing in the world. Come on.
We're supposed to help people out and be the body of Christ on earth, and everybody is chipping in and doing that, and it makes you proud to be a dentist.
It's amazing, and I've been waiting for something like this for a long time.
We see people that come in there that are absolutely beaten down by society and come out a new man or a new woman.
I didn't feel like I was at a place where I wasn't getting something for free. I was getting something I was somebody. I walked out of there with my head up.
With me being able to get my teeth fixed, and it's going to be able to change my life. I'm going to be able to go and smile in pictures. I'm going to be able to go out in public and not think that everybody's just looking at my teeth. They're actually going to be able to see me.
You take these individuals who will not raise their head, who will not hardly talk to you, who put their hand over their mouth because they're so ashamed of their appearance, and then you take them, they go from no smile to a big smile. Not only have we affected their health, but we've affected their life. Not only have we affected their health, we've affected the rest of their life. There is no event that is offered in the state of Arkansas that treat people medically, dentally, and overall health-wise like the Arkansas Mission of Mercy. Thank you all for being part of that.